Don't know what intellectual and developmental disabilities are?
Then, let's take a look.
And learn something new.
Let's define what are intellectual and developmental disorders. Intellectual and developmental disorders are differences that are usually present at birth and that uniquely affect the course of the individual's physical, intellectual, and emotional development. Many of these conditions affect multiple body parts or systems and start anytime before a child turns 18. It is characterized by differences with both intellectual and intelligence functioning, which include the ability to learn, reason, problem solve, and adapt behavior in everyday social and life skills. Intellectual and developmental disorders can be broken down into 4 categories to better help us understand. 1. Nervous system. These disorders affect how the brain, spinal cord, and nervous system function, which can affect intelligence and learning. These conditions can also cause other issues such as behavioral disorders, speech or language difficulties, seizures, and trouble with movement. Cerebral palsy, Down syndrome, Fragile X syndrome, and autism spectrum disorders are examples of intellectual and developmental disorders related to problems with the nervous system. 2. Sensory system. These disorders affect the senses and how the brain processes or interprets information from the senses. Preterm infants and infants exposed to infections such as cytomegalovirus may have reduced function with their eyesight and hearing. Being touched or held can also be difficult for people with sensory disorders. Metabolism. These disorders affect how the body uses food and other materials for energy and growth. For example, how the body breaks down food during digestion is a metabolic process. Problems with these processes can upset the balance of materials available for the body to function properly. Phenylketonuria and congenital hypothyroidism are examples of metabolic conditions that can lead to intellectual and developmental disorders. And finally, degenerative. Individuals with degenerative disorders may seem or be typical at birth and may meet usual developmental milestones for a time. But then, they experience disruptions in skills, abilities, and functions because of the condition. In some cases, the disorder may not be detected until the child is an adolescent or adult and starts to show symptoms or lose abilities. Some degenerative disorders result from other conditions such as untreated problems of the metabolism. Let's look at the characteristics of intellectual and developmental disorders. To do this, we will break them down into 4 categories: mild intellectual disability, moderate intellectual disability, severe intellectual disability, and profound intellectual disability. 1. Mild intellectual disability. No unusual physical signs but slight delay in developmental milestones. Capable of self-help skills, can learn practical skills, knowledge of reading, writing, and mathematical abilities up to standard 5. Can function normally in the society, normal social interactions and communicative skills. 2. Moderate intellectual disability may or may not have unusual physical signs, noticeable delay in developmental milestones, simple communicative skills, can learn basic self-help skills, hygiene and safety skills, can do simple tasks under supervision, can travel to unfamiliar places with proper instructions. Severe intellectual disability. Noticeable motor impairment is seen, significant delay in developmental milestones, limited communicative skills but can understand and respond to others' speech. Routine self-help skills and repetitive activities can be taught and followed. Requires close supervision in social situations. And 4. Profound intellectual disability. Significantly slow in developmental milestones. Presence of congenital physical anomalies. Requires close supervision and constant care. Not capable of self-care routines and activities. And response to physical and social activities is possible only if done on a regular basis.
The causes of intellectual and developmental disorders can vary depending on the specific condition. In some cases, the cause may be genetic or chromosomal abnormalities, while in other cases, environmental factors or complications during pregnancy or birth may play a role. Certain genetic or chromosomal abnormalities, such as Down syndrome, Fragile X syndrome, or Prader-Willi syndrome, can cause intellectual developmental disorders. Brain damage or injury due to trauma, infection, or other factors can sometimes result in intellectual and developmental disorders. Babies born prematurely or with a lower birth weight may also be at a higher risk. Infections during pregnancy, such as rubella or cytomegalovirus, can sometimes cause intellectual and developmental disorders in the baby. Exposure to toxins or environmental factors such as lead or mercury, or even alcohol during pregnancy may also contribute to increasing the risk factors. The deprivation of oxygen during childbirth can sometimes result in brain damage. Still, it is important to note that not all cases will have a clear origin point, and the specific cause can be difficult to determine in some cases. However, early identification and intervention can be helpful in managing the symptoms of intellectual and developmental disorders and improving the lives of the individuals with these conditions. Now, let's take a look at how prevalent intellectual and developmental disorders are. According to the World Health Organization, an estimated 3% of the global population has an intellectual disability, while up to 15% of the said population may have a developmental disorder, making intellectual and developmental disorders relatively common. In the United States, the Centers for Disease Control and Prevention, the CDC, estimates that around 6.5 million individuals have some form of intellectual and developmental disorder. Its prevalence varies depending on the specific condition. For example, the CDC estimates that around 1 in 54 children may have autism spectrum disorder or ASD, while around 1 in 6 children may have a developmental disability such as ADHD, intellectual disability, or learning disability. Intellectual and developmental disabilities can affect individuals of all ages, races, and ethnicities, but some populations may be more likely to experience IDD than others. For example, children born prematurely or with low birth weight may be at a higher risk of developing IDD, as are children from families with a history of intellectual disability or genetic disorders. Early identification, intervention, and support can be critical for individuals with intellectual and developmental disabilities to reach their full potential and lead fulfilling lives.
To some degree, the identification of causal factors can aid in preventing intellectual disability. It is necessary to take appropriate measures during various stages of development. Primary prevention. Providing genetic counseling to expectant parents is an effective primary prevention strategy, particularly when risk factors such as hereditary disabilities or consanguinity partners exist. 2. Offering prenatal care and guidance to expectant mothers, which includes recommendations to avoid substances that can impact fetal development. 3. Advising a balanced diet rich in vitamins and minerals such as folic acid, which is crucial for the growth and development of the fetus. 4. To prevent the spread of infectious diseases like measles, meningitis, and others, it is essential to have your babies vaccinated. Secondary prevention strategies aim at reducing the duration of severity of disability. 1. Neonatal screening, an effective preventative approach that involves both clinical and biochemical screening. 2. Manipulating the genetics or performing surgical procedures on a fetus affected by a biochemical or anatomical abnormalities are being explored. 3. Early identification of problems through newborn screening can facilitate the implementation of measures to mitigate the impact of disabilities. 4. Early intervention for intellectual disability can be initiated by identifying risk factors in young children. Tertiary prevention. The goal of tertiary prevention is to mitigate the impact of an existing disorder or disability. This often involves long-term care and management of chronic conditions, like adopting strategies that enable the disabled individual to lead a normal or near normal life. So why is it important to do an assessment? The purpose of the assessment is to determine the presence of a clinical condition according to defined criteria and recognize it as a distinct entity that requires suitable mental health services and decisions regarding placement. B. To identify and treat etiological factors and risk factors for intellectual disorders. C. To identify the needs implicated by the condition and design a program plan to reduce the disability impact. D. To match the nature and needs of the conditions effectively with the best intervention methods available. E. To evaluate the effectiveness of intervention. The process of diagnosis involves several elements which are outlined as follows: history taking, observation including medical examination, intellectual and adaptive behavioral assessment, identification of comorbid psychiatric disorders, and need-based laboratory investigations for other medical conditions.